This is the Professional Hypnotherapist podcast, a production of the European Association of Professional Hypnotherapists. That's eaph.ie. Thank you for joining me today on the Professional Hypnotherapist podcast. I'm your host, Aidan Noon. Garry Coles is the director and founder of the Association of Hypno-Oncology Practitioners and an international trainer of hypno-oncology. We hear from Garry as he shares with us his vast knowledge and experience in working with hypno-oncology clients. Did you know that 1 in 2 people will be diagnosed with cancer in their lifetime, and that 1 in 7 women will be diagnosed with breast cancer? And in men, 1 in 8 men will be diagnosed with prostate cancer. Garry tells us that hypno-oncology is an adjunct therapy to assist those going through the cancer journey. It is not a replacement for the treatment or advice given to you by your qualified medical and health professionals. There are many learnings in today's podcast, and I know that you will take away many of those learnings and use them in your own practice and take action so that you can use them in your own life. All on today's Professional Hypnotherapist podcast. The Association of Hypno-Oncology Practitioners is the brainchild of Garry Coles, who has a great belief in the power of the mind and in particular hypnotherapy, and has a passion for using it to empower and assist people going through the cancer journey. He is dedicated to spreading his experience and knowledge globally to help as many people as possible by training up qualified, professional, and ethical hypno-oncology practitioners to a high standard. Garry Coles, what a wonderful speciality you have, and welcome to the Professional Hypnotherapist podcast.
Good morning, and thank you very much for inviting me.
Thank you, Garry, and appreciate you being with me today. What got you into hypnotherapy in particular?
My hypnotherapy journey was actually a bit of an accident, to be honest, as was the oncology part of it. My original career, I studied maths and computer science, and I was an IT consultant in the oil industry. And that ended for various reasons, sort of business acquisitions and various reasons. And I was in a position where I had a couple of years off and didn't need to worry about working, but obviously had to get back to some work. And I wondered what I wanted to do next. I assumed it would be back in the IT world, but I wasn't particularly keen on that. The only thing I was keen on is I wanted to do something for myself, work for myself. And then just sort of looking around at various things, sort of amusing myself over the couple of years. I saw an advert for a psychologist, a doctor of psychology, who was doing introduction to hypnosis and hypnotherapy courses, and I thought that sounds quite fascinating. I'll go and have a little look, and the reason I got into that, funnily enough, was at the time I'd set up a web store for Christmas because I needed to make a little bit of money, and I was selling books. After Christmas came and went, I thought, well, what do I sell in January? And somebody offered me a job lot of hypnosis CDs for weight loss, quit smoking and stress and things like that.
Yeah.
And I was surprised how well they sold. So that sort of piqued an interest again in me. And I had some hypnotherapy books, like you do as a teenager, you get books on all sorts of subjects. So I went back and reread those. Then I saw this advert for this hypnotherapy sort of introduction training from a psychologist. And I thought, I'll go along and have a look. And my initial thought was perhaps I could learn something. Perhaps it would be something I could do, perhaps part-time on the side. But I must admit I was very skeptical because I come from a scientific background. I was very skeptical about hypnotherapy and hypnosis generally. And I went along to this introduction, and again, because to me, I felt that I couldn't be hypnotized. I saw other people being hypnotized. I felt that I couldn't be, and I was a little bit skeptical by it. And one of the things that happened on the course was the psychologist said, well, I'm going to deal with an issue for everybody. And he approached me and said, right, what issue would you like me to deal with? And I said, well, I haven't really got any issues. I haven't got any problems. But one thing that I did come up with was, since I was a child, I had nightmares many times a week, to the extent that I would wake up punching, kicking, shouting, doing that sort of thing.
Uh-huh.
But I'd then turn over and go back to sleep again. So to me, it was something normal. It wasn't, a problem. But he said, okay, we'll do some work on that. We spent an entire afternoon doing various techniques, which to me I felt didn't work. I didn't feel as though I was hypnotized. He tried IMR techniques and I didn't signal. He tried to get me to visualize things that to my mind didn't work. So I'm rubbish at visualizing. And we spent this whole afternoon doing this stuff. And at the end of it, he said, right, how do you feel? What do you think? And I said, well, I said, out of respect, I was keeping my eyes closed and going along with it out of respect for who you are, because you're very highly qualified and have a good reputation and so on. But I said, I'm still really skeptical about the whole thing. So I said, in my eyes, nothing happened. So I went away, sort of a little bit despondent to it. And I was just thinking around a month later that I suddenly realised I hadn't had a nightmare since. And that sort of was a big realisation. And I thought, well, if I was that sceptical and thought nothing had happened, and I've not had a nightmare, something obviously has happened that I haven't realised, and it's obviously a lot more powerful than I think.
Yeah.
So at that point, I decided to go back for proper training with him, and decided that again, at that point, I was going to set up just part-time. But I went back, I did some training, qualified with him. And then out of the blue, a few weeks later, I had a call from the hospital saying, we used to have a hypnotherapist at the hospital. We just understand you've just become qualified. Would you like to come and sort of help out the hospital? Because it's really useful working with cancer patients, and we'd like somebody to sort of hear. At that point, I must admit, I was feeling a little bit mercenary. I thought, well, can I set up part-time? Can I set up full-time? And I thought, I'm recently qualified. I'm inexperienced. I need experience. So my original thought was I'll go into the hospital. I'll stay there for a few weeks, get some experience, and then disappear. So I went into the hospital, and initially I was seeing 8 patients a day. The hospital was sending me on cancer courses, so I got a good background in that very quickly. And I never did go after my first few weeks. So I'm still there 16 and a half years later.
Wow.
So that was that side of it. And then because I'm a great believer in sort of going really professional at things, when I had the chance then to study in the first cohort in the UK for a master's degree in the subject, I did that, and I did a research project actually based in the cancer arena.
Okay, and where did you do the master's degree?
The University of West London.
Okay, that's very interesting, because there are not many academic institutions out there who provide academic qualifications in formal academic qualifications in hypnotherapy. That's good to know. Now,
it is sadly, I believe they no longer offer it, because it was done in conjunction with a private company, and I believe there was some monetary issues and copyright issues and various other things, and one of the people from the private company who was leading it passed away, and I believe it's sort of all fallen apart and is now no longer offered, sadly.
Well, maybe some other institution may jump on and actually do something about that. Now, you mentioned previously about your previous original working life in terms of being a mathematician or someone who is very left-brained, let's say. And would I be correct in saying you would be quite left-brained?
I would say so, yeah. I mean, yes, I studied maths and computer science originally, and I would sort of went through sort of being a computer programmer and then a business and IT consultant. So very much so. I was very much at my sort of the end of the career. It was in the oil industry, and I was sort of, if you like, software troubleshooting. So it would be large oil installations, and it was the measurement systems actually for oil wells and things. And if there was problems or updates needed doing, I would be the troubleshooter. So it was a very pressurized job, but also, yes, it was very much very logic based and analytical based.
And oftentimes, as hypnotherapists, we do come across clients who are left-brained, quite analytical, and we have to take a different approach. So here we are, there you are, as it were. You're going along to this psychologist, and you're learning about hypnotherapy, and yet you had to, at some stage, allow the right brain in to take over and allow something to happen. How did you manage that?
To be honest, I don't know. It just seemed to happen. It's one of those things that just happened, and that's what convinced me that there was obviously something in this. And again, but with the left brain side of it, that's when I took a decision, obviously, to do the master's degree and do everything scientifically. So although yes, it is sort of right brain. Although saying that, I guess the right brain stuff, I quite like art, and as a hobby, I play music.
Yeah.
So that there's an artistic side to me.
So there's an
So that's
all-rounder there.
yeah.
Yeah.
But certainly even with hypnotherapy, I do come at it from more of a scientific angle, if you like.
Yeah, yeah, and that's we'll touch on that in terms of the research base on which you do operate your work on, and the whole area, Garry, of hypno-oncology. It's a very sensitive area. It's something that calls for great sensitivity, great empathy. Would you speak to that for a moment, please?
Yeah, it does greatly, because obviously people just hear the word cancer. It's a
Yeah.
very emotive word. It strikes fear and panic into a lot of people straight away. So there is that side of it. And obviously, well, from my point of view, I deal with people through the entire journey. So, if you like, from day one, which is the diagnosis, which obviously can be a very fearful, panic-stricken time,
Hmm.
then through the whole journey from sort of treatment, whatever treatment they have, whether that's surgical, chemotherapy, radiotherapy, or other types of therapy such as immunotherapy and targeted therapies, and so on, hormonal therapies, and then coming out the other side. Hopefully, that's the best option. Obviously, coming out the other side, so they go back to full recovery. Obviously, we work on other sides of things, sadly, where it's palliative care, and also
Yeah.
sadly, we do lose people through
Yes, of
cancer,
course.
obviously, quite a lot. So we have to go through that area. Perhaps I don't get involved too much in the very end of life care, because here in this area where we have a very good sort of set up for that anyway. We have a very good sort of a couple of places that are very good for end of life care. So that isn't really carried out at the hospital. So that would go to sort of specialists outside the hospital. But again, we do deal with some of that, and obviously the carers, the relatives, the people left behind, who you also need to not forget,
Mhm.
because they're an integral part of the cancer person's journey.
Yeah, so it seems that there's perhaps to use an expression, there's a multidisciplinary approach to the care of the patient.
Absolutely, yeah, yeah, yeah. And certainly the hospital where I work, okay, yes, I'm there as the resident hypnotherapist, but the unit there offers a lot of complementary therapists in different sort of spheres of work. Because interestingly enough, in the Western world, one of the things that was carried out in SAGE research shows that certainly in the UK and in the US, 40% of cancer patients will seek out some sort of complementary or alternative therapy.
Hmm.
And in countries like Australia, it's up to 60 and 70%. And so
Hmm.
it's so if you think that's 40% in this country, that's 20% of the population, because 1 in 2 people actually will be affected by cancer. So theoretically, 20% of the population could be looking for your services as a hypnotherapist when they're going through that journey.
Hmm. And the whole area of orthodox medicine, because in your situation there, you say you've been at this hospital for 16 plus years,
Yeah.
working alongside a orthodox medicine. Generally speaking, what is your impression of how the orthodoxy, as we want to call it, that
Hmm.
accepts or receives or works in conjunction with the alternatives that are available or complementaries that are available?
Yeah, they are becoming more and more on side. I don't think we help ourselves in some ways, because obviously, as we know, hypnotherapy is not regulated, and there
Yeah.
are some very short courses, and people making all sorts of wild accusations. I see people advertising online that they can cure cancer with
Wow.
hypnotherapy, and all sorts of,
Gee.
meaningless statements, which unfortunately means that we're not taken seriously. But generally they are becoming more acceptable. When I started in the hospital, when I did my research, I became embedded into the breast cancer multidisciplinary surgery team for a year.
Yeah.
When I became involved in the team, some were quite anti. We had a professor there who was let's say mature in age. He was one of the leads, and to him, what I was offering was quackery. He wasn't particularly interested.
Yeah.
But we had other people. We had another surgeon on the team who, when he was being taught to be a surgeon, he actually attended an operation that was done under hypnotherapy rather than anaesthetic. So he was very on side because he could see the power of it.
Yeah.
The person I had to get my research passed for approval was the teaching surgeon, and I went through all the ethics side of things, which was quite difficult. And then they said, right, the final hurdle is you've got to sell this to the teaching surgeon. If she says yes, then you're on side, it's happening. If she says no, then that's it, it's not happening. I had a very brief meeting with her, and I got the impression that her attitude was, I'm a famous teaching surgeon, why are you wasting my time? But looking back on it, I think she was just trying to see how serious I was about my research and what I was offering. She gave me a really hard time, a lot of difficult questions, which I sort of thought I did okay at. And at the end of the meeting, she come back and said, yeah, okay, we'll do this. We'll do the research. I'll approve it. We can do it, which I thought that was great. And what I thought was fascinating was after I'd started doing the research, after a few months, she actually came to me one morning and she said, oh, now we know the sort of people that are going to respond and the sort of people that are going to be good for your research. And she said, once we've picked them, she said, if you want me to change my elective list around to accommodate the maximum amount you can see and what you do, just let me know and I'll do that. And I thought that was absolutely amazing, going from somebody who I got the impression was quite anti to actually now willing to move their elective surgery list around to accommodate my work.
Yeah.
So I thought that was brilliant.
Yeah, that's excellent, because what it actually has shown that she literally accepted that this is, what you say it is, it's effective.
Yeah, absolutely.
Yeah. Now, in terms of, say, for example, a patient who is presented with the diagnosis that they have a cancer, maybe non-specific. Maybe could you chart for us perhaps an approach that you would take, if that's possible, from the start?
Yeah, I mean, I would say that the approach is different for what they're coming to see me for each time. There isn't a one size fits all.
Okay.
And it's interesting that I think one of the most common questions I'm asked by hypnotherapists, and in fact, it's one of the reasons I put the course together initially,
Yeah.
was I had so many people contact me, hypnotherapists that were very well qualified, very experienced, but they were suddenly faced by somebody in their family or a close friend that had been diagnosed. And the question was always, what can I do to help? So all their training and expertise sort of fell out the window, really, because they felt equally hopeless. And it was always, well, what can I do to help? And it sounds a bit of a trite answer, but my standard answer is, what would the patient like you to help them with? Don't impose what you think they want help with.
Yeah.
Ask them what they want help with and work with that. So that is the first thing. And so be guided by the patient all the time. So if I've got somebody that comes to me, it depends what they want to achieve at that time. If it's on the day of the diagnosis, they might be having a panic attack or an anxiety attack, in which case we would use very fast interventions to stabilize them. They might be coming to me sort of later on in the journey, so they might be coming for pain control, for example. They may be coming to me because they have a side effect of one of the treatments they're having, so we would deal with that. It may be sort of pre and post surgery work. So everybody is different, so it's not a one sort of approach fits all. It's what is that patient presenting for, and then what do they want to achieve, and then put a plan together to assist them.
Yeah, that's I think that's an excellent way of putting it, because everybody's different, everybody has different needs and wants, and basically you're there to assist the client, as it were, in them achieving what they want to achieve.
Yeah, absolutely. Now, obviously, I have specific protocols that I find are more useful if you like. Obviously, having had that amount of experience, I've worked with several thousand cancer patients, and obviously the hospital has sent me on lots of courses as well. I've done my own research, so obviously because I have that background and a lot of knowledge, I know what works, what doesn't work, and what approaches are deemed most suitable. So if you like, I've got sort of protocols put together, and in some cases scripts and so on, that I would tend to use, but obviously everything is geared to the individual in front of me.
Yeah, everything sort of bespoke with the client.
Yeah.
Yeah. And in terms of the research that you have studied and that you've come across, was there one particular piece of research that really struck you, as it were, or strikes you that this is so important or so evidential that it's something that needs to be brought to everybody's attention?
In some ways, I would say the opposite.
Oh.
I was quite astounded. I mean, there is a lot of research out there for the use of hypnosis and hypnotherapy with cancer patients, and there's some very effective sort of protocols and studies that have been done.
Mm-hmm.
Particularly in the States, there's been a lot of stuff out there that I know at Sinai University, for example, Sinai Hospital, sorry, in New York. There's a lot of research being done, particularly with breast cancer patients. But it was the limitations that I found were quite astounding. Now, a couple of things that I found, and I'm not going to mention the particular researcher because of something I'm going to say, but it's somebody who's very well known for doing hypnosis breast cancer research. But my original plan was I'd looked at his research in depth and thought that actually I would like to base my research on his and see how much further we can take it. And I spent a lot of time chasing him up, trying to get hold of him, because I wanted sort of his induction scripts and various other things so that I could actually reproduce what he had done and move it further. Eventually, I finally got hold of him, and I think he was a little bit protective of his own work or whatever, but he was rather dismissive. It was, well, I've done loads of research in this area, why don't you go away and do something else? Which wasn't the answer I was really looking for. But then I looked into his research a little bit more closely, and found there were limitations. For example, where he'd done a lot of measurement on pain and anxiety, they were just basically done on 1 to 100 scales, rather than doing any sort of psychological sort of digging down and questionnaires. And I also found that a lot of the work he'd done, even on scales, were carried out a couple of hours after the operation. Now, to my mind, the people at that stage still have the effects of anaesthetic within their system,
sure.
And also pain control in their system. And for example, in the UK, I think it's 24 to 48 hours after general anaesthetic. You're not considered capable of fully functioning cognitively. So I was then wondering, well, are any of the results biased? Because surely the person will not have full cognitive ability at the stage when they were answering the questions. So I thought that was a limitation. And another big limitation I found, which I was astounded by, is that a great deal of hypnosis research, more in the clinical and medical areas, although the research was carried out by a psychologist or so on, typically a hypnotherapist wouldn't actually be involved. Most of the work was actually carried out by students or researchers that had had something in the region of half a day's training in hypnotherapy,
Yes.
and were effectively just reading a script.
Yeah.
So to my mind, that wasn't also a valid session, sort of a valid sort of way of setting it up, because obviously some of us have a lot of training, we have a lot of experience, and we know that things like the rapport, presentation, and there are many other factors that are a factor in a hypnotherapy session, which to my mind were being completely omitted because you were having somebody with a couple of hours tuition reading from a script. So I think some of that was invalidated, which is why I wanted to do my own research.
Yeah, indeed. And in terms of your own research, Garry, what have you come up with?
What I did was I did a study, and it was for my master's degree.
Yeah.
I did a study into pre-surgical hypnosis and the effects that it had on the recovery quality in breast cancer operations.
Lovely.
And what I was looking at, it was based on some of the previous research that I mentioned, but and I found out as much as I could about the previous research that had been done, and decided that if I added a couple of other techniques into the mix, and also it was carried out by a trained hypnotherapist, that we could get better results. And I used what they called an SF-36 form, which is a gold standard psychological welfare questionnaire that is used in many psychological and health studies. And the idea, it's 36 questions, and you then put it into a computer program, and it gives assessments for the person's psychological well-being, and it looks at a lot of different factors of psychological well-being. So that was what we were looking at. And what I did was I did the questionnaire with somebody on the day of their operation. So it was basically just before they had their pre-med.
Okay.
And we did a control group, and then we had another group that after they'd done the questionnaire, they had a session of pre-surgical hypnosis with me. Now the session was scripted rather than bespoke. Obviously, I'd like to have done more bespoke, but obviously for research purposes, that's not going to give good results. So it had to be scripted. So we did that, and then did a follow-up a week after surgery. And what was interesting, some of it wasn't surprising, but both groups on the day of the operation, when they done the research questionnaire, they were all borderline depressive. Now, obviously, if you've been diagnosed with breast cancer and you're going in for an operation that day, that is not a major surprise.
Absolutely.
Yeah. But then when we followed up a week later, the control group was still borderline depressive. The group that had the hypnosis were actually back to what was considered population norm. So back to their normal feeling and way of life and so on. So obviously that was a great improvement psychologically, because generally it was believed that psychologically they will have a fast recovery quality, they can get out of hospital quicker, and so on. But another thing that we looked at was also pain perception. And it was interesting that a week after the operation, the hypnotherapy group perceived that they were feeling far less pain than the control group. When we dived down and looked a bit further into things, we found that not only did the hypnotherapy group perceive that they were feeling less pain, but actually they were actually taking far less pain medication than the control group in the first place. So to me there was two big things there: the psychological element and the pain element.
Indeed. And I love your use of the word perceive, because it is all about perception, and they perceived that they had less pain, and therefore they took less medication to ease the pain, as it were. Now, in terms of qualities that what in your opinion, Garry, is the most crucial trait that someone needs to possess as a hypno-oncology practitioner?
To me, the big thing to me is, everybody would say empathy and so on, but to me, it's ethics. I think you've got to be very, very ethical, and that's why it irritates me with some of the things that I see, because people with cancer are very desperate. And I see so many people clutching at straws, paying out lots of money for so-called complementary treatments, anything that they think might give them a chance. You see in Facebook groups and various other things, people advising on this diet, that diet, taking these supplements, doing this, that, and the other, and there is very little or no scientific evidence for any of it. But yet people are desperate and will pay a lot of money for somebody that might be able to give them a chance. And I do see hypnotherapists even, particularly in the US, that are advertising that they can cure cancer with hypnosis and mind control. Now, okay, we do know that we do get spontaneous remission, and we do know that things go away. But we have no evidence that that's what's caused it, or that's what's cured it. It might be that in conjunction with lots of other things, or it just might be a coincidence. And certainly from an ethics point of view, we do have in the UK, we have a 1939 Cancer Act, which forbids you to treat or advise or consult on the treatment of cancer unless you're an oncologist or a doctor or a surgeon. So we have to be very careful about what we work with. But saying that, yes, to me, the biggest thing is being ethical about what you're doing.
Yeah, I think that's really, really important, and as this podcast is a production of the European Association of Professional Hypnotherapists, and all our therapists, hypnotherapists, subscribe to this code of ethics and professional conduct. That is something that is, it is a must that we have that professional ethics and going forward.
Yeah, indeed, and that was one of the things again why I put actually decided to form the Association of Hypno-Oncology Practitioners, because originally I just started doing training, and the reason I started doing training was again as I mentioned earlier, a few people said to me, "Oh, you're an expert in this area, you need to put a training course together," and I thought nobody's going to be interested, and then I found that I was getting more and more hypnotherapists, highly qualified, experienced ones that had come across cancer in sort of the family.
Yeah.
And just didn't know what to do, and was asking for advice. So I thought, well, perhaps I ought to put a training course together. What really pushed me into it was I was asked to speak at one of the UK's inaugural hypnotherapy conferences about 8 years ago on what I do, and I've since spoken there sort of half a dozen times. And then I was invited out to the biggest hypnotherapy conference in the world out in Las Vegas. And I'm going back to speak for the fifth year, actually in July there. So I found I was starting getting invited around the world to talk about what I do. And I thought, well, okay, yeah, it must be time to put a course together. So I did put a course together, and I did it originally in the UK a few times, but then I was asked to actually start doing it abroad. So I've taught in the US several times. In fact, I'm teaching in Florida in May and Vegas in August. Then I've been out into Europe a few times. Just before the lockdown, I did one in Belgium. And now what is also encouraging is I'm finding that obviously it was originally geared to hypnotherapists, but I'm finding now between 30 and 50% of attendees are actually doctors and psychologists rather than pure hypnotherapists.
Yeah.
In fact, the last course I did before the lockdown I was actually invited to go and teach do a private course for a group of psychologists in Bahrain. So none of them were pure hypnotherapists; they were all clinical psychologists. So that was encouraging. Since the lockdown, I've done it online. I've done some courses to Australia and New Zealand and the States. But the reason I actually then put the idea of the Hypno-Oncology Association together was that I found that I had a lot of very well-meaning people that were wanting to attend my course, that were perhaps trainee hypnotherapists. They might have only done a month of training, or they were just well-meaning. They wanted to help but had no real background in it. And at that point, obviously, I don't want to discourage people for having an interest, getting involved and finding out and so on. But from the ethics point of view, I wanted to protect the patient first and foremost. So what I decided to do was anybody can attend the training, but to actually become accredited, therefore part of the association, not only do you have to do the training, but you have to pass an exam as well. And the exam actually looks at not only the hypno-oncology training, but also general experience and knowledge of hypnotherapy practice going forward. So that way, I could say, well, anybody that joins the association, I am confident are good and competent ethical hypnotherapists, and therefore I would feel safe them working with patients.
Excellent. Now, is it possible for you to tell us about the course that you put together?
It looks at all aspects. I mean, one of the first things it does we start on is we look at cancer itself, because particularly if you're going to work in a hospital, for example, and we know rapport can be a big thing with hypnotherapy. If you're working in a hospital, you're going to be considered to be a professional, an expert in what you do. But if you're there in the cancer unit, you'll probably find a patient coming in, clutching their patient notes, saying, "Oh, I've got such and such a cancer, sort of stage 3, grade 2. This is the treatment I'm having," and so on. And if you suddenly look at them blankly, you're going to have lost all that respect and rapport out the window straight away. So the first part of the course does teach you gives you a cancer background. So we go into what it is, how it forms, we look at all the staging, we look at the grading, we look at the treatments, we look at the potential side effects of the treatments, and therefore we then look at what you can work with as a hypnotherapist. We look at the legal and ethical aspects of it as well. But then we go into what you can actually do as a hypnotherapist. So we would look at things like sort of dealing with the panic, the fear, the stress, and so on of diagnosis, or certain fears and phobias like going into scanners, for example, having masks put on for head and neck cancers, that type of thing. So we teach a lot of very fast techniques that you can work with people in those sort of situations to overcome things quickly. And then we look at more sort of longer term work with people.
Yeah.
So we would look at, particularly, as a lot of work you can do with side effects, things like anticipatory nausea, which comes with chemotherapy, the sleep issues, and so on. We do work on pre and post surgery work because, as we just mentioned on my research, we demonstrated that it can have a big impact on the recovery quality. We do a lot of work on also on pain control, various types of pain control that you can work with cancer patients, and even the journey after sort of cancer. We go on to the side of whether we need palliative care. So we go down that route, palliative care, and perhaps, obviously inevitable, sadly, not a good outcome. We look at what you can do with the carers and the family members, and we also look at sort of post cancer. The people that do get down the recovery route. We look at sort of what differences that may have an impact on their life, and deal with that going forward, or even improving other aspects of their life. So there's an awful lot you can do with it, and that's all covered in the course. We also look at other things about how you can do group sessions, which I do sometimes in hospital, and even how you can do all these sort of techniques and approaches over Zoom, so that you can work with clients all over the world.
Excellent. Now, you mentioned there about carers and family members. What's your approach in that instance?
Again, it's the same sort of thing as with the patient. What would they like help with? What would they like help coming to terms with? Or whether it's quite often it's anxiety-based things, quite often it's fear-based things, or even looking forward, or not in a negative way. Obviously, they're going to be looking forward, but assisting them in, if you like, in looking forward, in coming to terms, either what they would need to do to help the patient through their journey, or even helping them to come to terms with what the outcome might be. So again, you're still sort of, if you like, client or patient led on that front.
Excellent. So it's a very comprehensive course, Garry, and obviously, it's evidence based. You have your research, and if anyone out there who's interested, any hypnotherapist who's interested in completing this course, how can they contact you?
Well, we have a website purely for oncology, and that is the website is www, obviously, hypno-oncology.com, or hyphen, depending on which part of the world you're in, but hypno-oncology.com. On there, there is actually, because I've actually done it in conjunction with a conference recently, there's an online version of the course, which is currently at half price, and that's at hypno-oncology.com/online, and also under live, I believe. For people that actually want to keep it, there is a product section, and you can have the whole course on a USB card, so that you can watch it over and over again. And obviously, I do live courses as well. There's a couple mentioned on there. As I said, the only two so far I've got this year planned is I'm going to be at the IMDHA conference in Florida, in Orlando, in mid-May, where I'll be teaching and also talking, and I will be at HTL Hypnothoughts Live in Vegas at the end of July, where I'm also going to be presenting and teaching. So there are online options. There's USB keep it options, and obviously live options.
Excellent. Thank you, Garry. So is there a particular case study that you could mention for us?
Yeah, well, I mean, I've got loads and loads of case studies, and that's actually, there's a lot covered on the course, because I do a big session on the course of thinking outside the box. Lots of instances that I've come across where might not be straightforward, and don't really suit the normal ways of working. I've got a lot of those, and they're covered on the course. I do have some rather sad case studies where I've worked with people, and although the outcome has been terminal, that I have been able to help them in very good psychological ways, which we also cover. But there's one I'd like to finish with, which is a nice one, because I'd like to leave talks on a happy note.
Yes.
But it was one particular patient that I worked with a few years ago. She was quite young, early 30s, had a very active lifestyle. She was into parachuting and all sorts of things like that. She was diagnosed with colon cancer, and initially was told that they didn't think it was particularly bad, and she would have keyhole surgery and everything would be fine. They took her in for the operation, and they opened her up, and they found that it had spread hugely. They decided they had to remove the entire colon. There was other areas needed to be removed. She had to have a colostomy fitted. Because it had spread, they had to break all her ribs on one side to actually get access to everything. So they did this major operation. Obviously, she came round, had been operated far more severely than she expected. She was in a lot of pain because all her ribs had been broken, lots of stuff had been removed. Because it had spread, she also needed quite heavy-duty chemotherapy, and she reacted badly to the chemotherapy, and she actually died 3 times and had to be resuscitated. The first time I saw her was after she'd been resuscitated for the 3rd time. She was an inpatient in hospital. She was in a huge amount of pain, couldn't sleep because of the pain, despite all the pain medication. And I was asked whether I would see her on the ward and whether I could do some stuff with her for pain control, de-stressing, and help with her sleep. So I did some work with her as an inpatient, and we worked on that and helped with the pain, helped with how she was feeling, coming to terms with things, and helped with the sleep. Then she was discharged from hospital, and she came to see me for further other things, psychological aspects, sleeping, stress, and various other things that we worked with through her journey. And that was a few years ago. The last time she saw me, she came to me as a private client, and she came to me for assistance sports performance. She wanted me to help her improve her triathlon performances. So I think that's quite a nice outcome.
Excellent. That was wonderful. Maybe you just give us your website again, please.
Yeah, absolutely. And I'm quite happy if anybody has got any interest in the course, wants to ask questions, even if they're not interested in the course and they just want to ask questions, I'm more than happy. There is a contact form on the website. But the website is hypno-oncology.com, or hypno-oncology.com, because the Americans call it dash, we call it hyphen. So hypno-oncology.com, and there's lots of stuff you can find out on there about my live trainings, my online trainings, and there's a contact form for any questions that anybody'd like to send to me.
Excellent. So that was Garry Coles, hypno-oncology practitioner and trainer. Thank you, Garry.
Thank you very much. Thank you for inviting me.
Thank you very much for joining me today on the Professional Hypnotherapist podcast. Please head over to eaph.ie and find solutions for you right now.